Hello. Over 80% of the population suffers with back pain of some type, whether it be sprain, strain, disc problems, even some sciatica. It's very important as a doctor that you get assessed. I am your top-rated Freehold Chiropractor, and we see these types of patients every single day. And we always start off a treatment plan with adjusting and therapeutic stretching. But as we go through the treatment, it's very important to start incorporating exercises to help strengthen the core and help prevent future problems. So one of the very first exercises we're going to start with today is what's called a pelvic tilt. So for the demonstration of this, I'm going to lay down on the table over as you lay down, I'm just going to get down to this position, and you're either going to do this on a firm table or even on the floor. And what you're going to do is you'll lay on your back, and you're going to have your knees bent. And most people, when they're laying like this, they can slide their hands under their back, and you're going to feel an arch, okay? With your back arched like that, it's showing a weakness down here. So with the pelvic tilt, we're going to pull our belly and our back down towards the ground like this, and this is a basic pelvic tilt. So I'm going to show a couple repetitions, and as we do this, you can see I'm just rolling the pelvis back like this. I'm not lifting the butt up, which a lot of people do. It's actually just using your stomach muscles and your back muscles to build the core. You can put your hands underneath your back like this, so when you squeeze down, you'll actually feel your back squeezing against your hands. So when we do this, we're just going to do repetitions, and you're going to squeeze and hold for a second, then relax. Squeeze again, and relax. With my patients, I have you do these 2 to 3 sets of 15, and only 2 to 3 days a week. And when you're comfortable doing 3 sets of 15 at 1 second, we're then going to increase and hold them like this and hold for 3 seconds. Then relax. And relax. When you can do 3 sets 15, no problem. At 3 seconds, we're going to build up to 5 seconds. So it's going to be like this. Relax. Okay? Now, the reason why we're doing this is, unlike other muscles like your biceps, your leg muscles, these are all strong, big muscles. Our back and spinal muscles are more for endurance, so we want to hold these exercises for a little bit extended period of time. I don't want you going any longer than 5 seconds. Now, once you get up to the 5-second pelvic tilts, we want to advance these exercises, okay, because it's going to help build the core more. And the next exercise is going to be what's called a pelvic tilt with a leg raise. And after we do the pelvic tilt with the leg raise, as you get more and more comfortable with it, I'm going to show you how to do a pelvic tilt into a bridge, and then a pelvic tilt into a bridge with a leg raise. And I'm going to lay back down and I'll go through these again so you can actually see and start doing them for yourself. If you're not a patient of mine, I want you to talk to your doctor, or if you need to, give us a call and make an appointment so I can come in and we can work on your back, correct the underlying imbalances and mechanical imbalances, and then we can strengthen it properly. Okay, so I'm going to lay back down. So for the pelvic tilt with the leg raise, it's going to be, the first step is doing a pelvic tilt, squeeze and hold this. And the leg raise is actually just straightening one leg at a time. One like that, and then down, and then the other one, and down, and relax. That would be 1 repetition. Sometimes you want to start off left leg first and right. So this time I'm going to go like this, pelvic tilt, left leg, down, right leg, down, and then relax. So those are the pelvic tilt with the leg raises. Then as you're more comfortable and getting strong with your back, you'll work into a bridge. Now a bridge, most people, again, wrong is what most people do, is just arching like this. And you can see how my whole back is arched. Now what I want you to do is do step by step. You're going to do a pelvic tilt, hold this, and then push up into the bridge. you can see everything is pretty much in a straight line as long as I hold this pelvic tilt. We're going to bridge down, then release the pelvic tilt. Again, pelvic tilt, bridge up. If you lose that pelvic tilt, you'll arch. Okay, so pelvic tilt, bridge, down, relaxed. The advanced form of a regular bridge is with the leg raise, and again, it gets more difficult. I don't want you to start off with these. You're going to do a pelvic tilt, bridge, leg raise, down, relaxed. Okay? Make sure you go through each step, and it'll help you strengthen and stabilize that back. Now, after doing pelvic tilts and bridging, I also want you to do an exercise called the quadruped. And for this, you're going to get on your hands and knees. Again, I want you to do this on a firm surface. None of these exercises can be done on your bed. The mattress is too soft for you. So again, on this table, I'm going to get into the standard quadruped position on the hands and knees, just like this. Now, what you're going to start off doing first, and again, every one of these exercises, I want you to do up to 3 sets of 15. So with this, you're going to start off just raising one arm and down, the other arm and down. And then you can do each leg individually. Bring the leg up and down, the other leg up and down. When you can do this exercise, each arm and each leg individually, we're then going to advance it even further. So with this, what we're going to do is for one repetition, you're going to raise your right arm and your left leg and down. Left arm and right leg and down. And again, just go through these. And you'll feel the muscles working in the lower back and also through your glutes. If at any time with any exercise you're doing, you start feeling back pain, you need to stop immediately, okay? You should not be feeling any pain while you're doing exercise. After doing these exercises, you might feel some soreness. If you're sore, I want you to put some ice on it for 15 to 20 minutes at a time, and you can also refer back to some of our low back and hip stretching. The final exercise we're going to do for core stabilization today on this video, you're going to lay on your side and you're going to get into this position. You'll keep your knees slightly bent, one leg on top of the other. And from here, all you're going to do is you're going to raise the top leg about 3 feet off the other leg and down. It's very simple. It's an abduction exercise, and it's helping to work the hip and gluteal muscles, just like that. Again, up to 3 sets of 15. Once these get comfortable and you want to make this exercise a little advanced, you're going to actually bring the top leg forward by about 1 foot, and from this position, raise the leg up, again, about 3 feet. 3 sets of up to 15. All right? Very simple exercises that you can start doing to help stabilize and prevent future problems with your back. But again, like I said earlier in this video, if you're having any back problems, it's very important to have the underlying problem worked on first to make sure all the joints, tendons, and ligaments are stable before you start doing strengthening and these types of exercises. Anyway, I hope you found this video very helpful. If you're one of my patients, please make this a consistent thing. It's just like brushing your teeth for your, prevention and making sure that your teeth don't have problems down the road. These exercises are very important for any therapeutic low back strengthening protocol. If you have any questions at all, give us a call, 732-780-0044, or you can go to our website for other helpful health tips at chiropractorfreehold.com.